afternoon and welcome to Healthy Lifestyle. I'm Lorianne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to a fulfilling, a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. Today we have a full-packed day with Dr. Michael Grosso, Chief Medical Officer and Chairman of the Department of Pediatrics at Huntington Hospital, which is part of the Northwell Health family. And we have a lot of topics to cover, so we're going to jump right in. How are you today, Doc?
I'm really well. So happy to be back.
I'm so happy to have you back. We really are. So there's a lot of new going on in Huntington Hospital. One of the newest things is your renovations for the orthopedics department. You want to talk a little bit about that?
Yeah. So orthopedics is very important to us at Huntington. Right now, we're in the midst of building 6 new private rooms to make the stay more comfortable for patients undergoing joint replacement surgery and other similar procedures. As a matter of fact, coming up in just a few weeks, we are having an alumni breakfast for individuals who underwent joint replacement surgery at Huntington Hospital. And one of our joint replacement alumni is Hockey Hall of Famer Clark Gillies.
Oh, really?
Big supporter of ours. He's had more than one joint replaced. Hips and knees, you only own 4 altogether, but he's been back to us, has been a big part of supporting the program at Huntington.
Wow, that's amazing. So when is the alumni breakfast?
It's happening in May.
In May? Okay. We'll make sure we put that information up on our website. So that's exciting. So 6 new private rooms. What was the reason why we decided we were going to expand?
So we're doing more and more joint replacement surgery at Huntington, and that goes back a while. As a matter of fact, Huntington Hospital was the first hospital on Long Island to receive a special designation from the country's largest quality improvement group called the Joint Commission for excellence in joint replacement surgery.
Wow.
And so, we want to make every aspect of care for patients undergoing that important surgical experience as good as it can possibly be.
I understand. You definitely always are looking to raise the bar on providing wonderful service and hospital care. So that's exciting. And how about the expansion in the cancer care section?
So Huntington, as part of the Northwell family, is on track to become an eastern hub for cancer care for our health system. As you may know, Northwell Health spans several counties, but out in Suffolk County, we're planning a cancer hub which will be centered in an outpatient facility, where oncologists and surgeons who do oncologic surgery in urology, neurosurgery, gynecologic surgery, and others will be co-located to better take care of patients there and take care of those patients' inpatient needs when they're at Huntington Hospital.
So you're really building out your program and providing all this service under one roof.
Right.
So the patients are able to move swiftly in one building as opposed to going to different sites.
Yeah, and we've been able to recruit some really, really excellent individuals. One I'll just mention is our chief of urologic surgery, who's a urologic oncologist. He had actually started a program in another New York metro area institution before coming to us at Huntington to start not just a new department of urology that'll be focused on urologic oncology, but within the next 2 years, a new residency training program as well. So it'll be an academic center as well as a clinical center for urologic oncology.
That's outstanding. And you have 3 new surgical oncologists, right?
Yes.
That just joined the group?
Yeah, so they'll be bringing a diversity of expertise in medical oncology. There's a very tight partnership that has to happen between the people who operate and the medical oncologists in providing comprehensive care for people with cancers of many, many kinds.
Now, does this program differ from that you might receive from other institutions?
What's really important is the co-location of the best people and the kind of collaboration and care coordination that's necessary. It's hard enough for any of us just trying to remember going to your internist for your yearly checkup.
For goodness sakes, yeah.
And to get that colonoscopy done. I mean, imagine if you have a complicated disease like cancer and having to worry not only about your illness, but trying to make sure your medical records move from one place to another and that all the appointments are coordinated. We'd like to take care of all that so people can just focus on feeling better and getting better.
Yeah, that's great. I had already said, my mom passed, actually her passing anniversary was yesterday, 13 years ago from cancer. And that was one of the things I didn't understand. They needed a quarterback to sit there and help the rest of the team know what everybody's doing, and each person was working autonomous, and it was very, very frustrating as family members to try to coordinate all that information. First of all, it's hard to overcome the emotional feeling that you have, and then to be able to digest all this information that half of which you just really don't understand, and you need subtitles to really understand what you're supposed to be doing or where you're supposed to be going and what other things you should look for and what alternatives are out there. So I love the fact that you have a program like that would enable, I'm presuming, the families to be able to take a breath, support their loved one, and be able to know that they have these unbelievably sensitive, caring people in your program providing that tool, right?
Yeah. It's all very important. The healthcare system in the past has really not done the best job in taking care of the whole person.
Yes.
And the family surrounding that person. One thing that we're able to bring to a program like this is the ability not just to care for the person's cancer, but for all their other medical problems. People are living longer and longer.
Sure.
And years ago, when the last generation of cancer hospitals were built, including some famous institutions around the country, the whole focus was on cancer.
Yes.
And when you think about it, as much as that sounds like a good tagline, it's no longer the right way to provide the care, because you may also have diabetes. You may also have heart disease.
Right.
And if you come into that big institution and say, well, I'm sorry, we can only take care of your cancer, it just doesn't really work very well.
Yeah, well, it's likened to, going to a dentist and having them look at a tooth as opposed to all of them. Well, that doesn't make sense. So the same thing as you're in, and that's one of the things, the challenges we had was that there were other needs. So you're running from where she was getting her cancer treatments to over here for other treatments and it's overwhelming. And again, you're already just cloaked with all these emotions, and it's hard to think. Sometimes you can't really crystallize a lot of the information and process it. So this is a great program. I'm finding more and more in the Northwell Health family that they are really approaching. You guys are really approaching medical care in that way. And Huntington of the family seems to be like just years ahead of everybody around here, at least in my experience and knowledge, with doing things like this. It's astounding. And you're the chief medical officer for Huntington, right?
Right.
So you may have something to do with this, huh?
We have a big team of really talented people. And the one thing they share a lot of things, but one thing they share is a state of constant dissatisfaction with the status quo. As soon as you
say that again, I love that.
Constant dissatisfaction with the status quo.
Making it better, trying to make it always better.
As soon as you think you've got it all right, you're on the wrong road, because there's always more to do to make care better.
Yeah, it's funny because it's a different topic, but it's the same principle. As I was recently speaking to someone, and they're like, well, this is how we always did it, and we don't want to upset the apple cart. And I was like, well, just because we're moving forward and adding other things doesn't mean we're upsetting the apple cart. We're just taking the apple cart and upgrading it, making it a little better, maybe bringing it forward. And that's what we do, right? Even in technology, you go from a flip phone to the type of phones we have today. Who knew when we had flip phones that this was possible? And might I date myself, I had a phone in a bag that we used to carry around years ago as our car phones. You're both probably too young for that, but I remember those days, and I would never think that a flip phone was even possible, that small, that would fit in my purse. It's really cool. Same thing with medical care, and even better, because that is why our lives are longer now, and our lives are much better. I mean, that's my age years ago wouldn't be doing, going skiing because they wouldn't want to risk throwing a hip. I'm like, no, I'm good. We're good.
So I just got to set the record straight on one issue. I'm old enough to remember when dialing a phone actually was the right verb.
Yeah, me too.
Yeah.
I had a princess phone, so don't start. And I had one of those really, really long cords that used to wind up, and you periodically had to like pull it across the entire house so that you can unwind it. Tell me you remember those.
I do.
All right, so we're in the same. Allie, not so much. Yeah, and we know phone booths too then.
That's right.
Yeah. So a friend of mine was just down at Disney taking a picture in a phone booth because, it was retro. And I'm like, really? All right. So sometimes I feel very old. And I'm not, but sometimes I feel that way. So these are all exciting things. Also, you have an enhanced recovery after surgery program, yeah?
Yeah, so can't take credit for the idea. This is something...
Well, you can, but...
Well, I will, but...
Okay, good.
Now, this is something your listeners should know about. There's actually been a national movement brewing very gradually, moving across the country, getting into some parts and some institutions sooner than others. We're very excited about integrating principles of early recovery after surgery, or ERAS. We love acronyms in medicine.
Yes, you do.
And so what's that about? We've figured out, the people who research in anesthesia and surgery, that a lot of what we thought were the best things to do for patients 5, 10, and 20 years ago were not really the absolute best things to do for patients, just like there are things better than flip phones. So one of those things was having patients fast for a long time before their procedure. If you ever had even a minor procedure,
yes,
remember
please.
being told don't eat anything after midnight. And
it's the no coffee thing that gets me. But anyway, that's another conversation.
So that's one of three things that is not as good an idea as it at first seemed to be. The original reason was to prevent a problem where the contents of the stomach get into the airway while you're asleep under anesthesia. And that's a good thing to prevent.
Sure, of course.
But it turned out that we were keeping patients without nutrition or fluids for much longer than they really, really needed to be. And it turns out it's not just that it's inconvenient or you feel hungry
and lightheaded.
It's
and set off my migraines, but another conversation.
Yeah, it's not good for your body if you're undergoing a surgical procedure.
Well, don't you want to be the strongest?
Yeah.
Right? And hydrated, don't you think?
There's actually a starvation state. It sounds dramatic, but our metabolism actually switches gears when we stop consuming carbohydrates altogether. And that shift is an evolutionary thing that allowed our ancestors to go without, the next mastodon for a while. But when you're undergoing a surgical operation, it's really not good to be in the starvation state.
Yeah.
So part of ERAS is altering those guidelines just a little bit so that there could be some fluid, some carbohydrate, much closer to surgery than we used to think was safe. And this has been tested in studies, and it works, and you feel better sooner.
See,
and
it makes perfect sense to me, because as your system, when you go into that emergency state, that's how I always refer to it, is when you go into that emergency state, all your systems are focused on survival as opposed to being prepared to have surgery and being at its strongest. So it never intuitively made sense to me. I'm like, please, somebody explain this to me. And my brother's a doctor. He's a neonatologist. And he was like, well, just follow the doctor's orders. And that's all he would say. And I'm like, well, what does that mean? I need more information than that. But it sounds more intuitive to me that we would do this. And so is it a huge difference? So I'm a migraine sufferer. It's familia. But if I don't have caffeine in the morning, it will set off. And then we have other things to deal with, the headaches, putting aside the headaches. Most of the time they wouldn't let me take my migraine med because I was going under anesthesia. So then I would actually have a headache, and then light and sound killed me. So, and of course, when you're going there, all those lights are really bright, and you're not out when they used to put the lights on. Oh my gosh, it was just like a cacophony of a mess.
Yeah,
it was just a mess.
A lot of that has changed. First of all, clear fluid with little carbohydrate, little sugar in it, up to 2 hours before most kinds of surgery seems to be fine.
Great.
And people don't ask patients to stop taking their regular medications anymore. A sip of water does not make a difference for this safety issue.
Right.
So all that's changed. But as they say on the late night infomercials, there's more.
Ginsu knives? I'm so excited.
There are two other things that we used to think were the right best thing to do that aren't. The next thing has to do with right after surgery.
Okay.
And it's the whole notion of moving around, right? So people used to kind of lay in bed for a while. That's all changed. And speaking of orthopedics, that's been really at the cutting edge of this. You'd think after operating on your legs that you may not want to put weight on them, but we do. After a joint replacement surgery, within hours after waking up from anesthesia, they call it day zero, post-operative day zero, to dangle your legs and maybe even walk a little bit, because that keeps you from getting weak. It enhances the rate at which you regain, your mobility and your strength, and you feel better. And so all that has just been turned on its head, and not just for orthopedic surgery, but just in general, because you also prevent blood clots.
Sure.
And you prevent problems with the lungs not expanding, because if you're laying flat on your back, that's not really good for your lungs either. So mobility after surgery is now different than it used to be.
Yeah, that's really exciting, because then I see that more and more across the board, even giving birth and right afterwards they're like, okay, let's go up and out and the whole 9 yards. And it just, again, it seems very intuitive, but now there's medical backup that allows us to really do that safely.
Yeah, there's good science behind all this. And there's one more piece.
Okay.
And the third
There's more.
There's more.
That's
Here's the
so
last
exciting.
piece. There's actually more than more, but I'll tell you about one more piece today. And that has to do with pain control.
Okay.
Now, I think all your listeners know how concerned the whole country is about the opiate epidemic.
Yeah.
Well, it turns out that there's a measurable fraction, I forget the number, maybe 4% of individuals who have their first introduction to opiates around the time of surgery.
Yes.
And go on to opiate dependence.
Yes.
So the use of opiates now is much different and much, much more judicious than it ever was. And for some kinds of surgery, you don't need any kind of opiates at all. There are other kinds of pain medication that can be used in combination to achieve just as much pain control and avoid a lot of side effects. Not just opiate addiction, but also nausea, vomiting, constipation, dizziness, falls, all the things that are likelier to happen if you get morphine or morphine-like chemicals than if you get safer kinds of pain medicine.
So is Huntington Hospital a proponent of utilizing Western and Eastern medicine? Are you more Western medicine type, or? Well,
I suppose if I had to do the balance scale, there's more Western than Eastern. However, we do have programs in the hospital that utilize holistic methods. It includes aromatherapy. We actually have a very extensive aromatherapy program.
Yeah.
Also massage, Reiki. So more and more we've been integrating other therapies. And you're right to bring that up in connection with pain control, because that's one of the big advantages of using these alternatives.
Yeah.
Pain is a product of our brain at the end of the day. And anything we can do that changes that situation, is good.
I have acupuncture for my migraines, and it works. It's magic. It's just magic. It just gets rid of that. It gives me such relief. It's amazing without having to take any medicines, which is great. So I love that you integrate it. And again, you guys are Huntington Hospital is right on the cutting edge. You're open to just about consideration of just about anything, as long as it works for your patients, right? Yeah. I love it. Do patients ever bring you things? Ideas of,
pretty often.
Can we use this?
Yeah, it does come up, and we try to accommodate whatever we can. Hospital routines have been the enemy of improvement, right? As you said earlier, well, this is the way we do things. These are the times we administer medications. By the way, one of the dumb things that we recently realized collectively is that we wake up patients in the morning to give them medications at times they never would have taken them at home and didn't need to take them.
Yeah.
So
I was always exhausted leaving a hospital. Not that thankfully I was in it a lot, but I was just like, why can't they just let me sleep?
Yeah. So actually we're focused focusing on that right now. You'd be surprised as to how hard it is to fix some of these things, because we have an electronic health record, and the EHR kind of tells you what the standard times are to order medications, and so you have to change the whole program if you're going to give the medications an hour later. But we're doing all that work because waking up people to draw their blood, waking up people to take their blood pressure or give a medication an hour or two on either way doesn't affect their medical care, but it disrupts their sleep.
Yes.
If it's 5 o'clock in the morning,
which affects their health care
Yes.
overall, because they're tired, they're exhausted, so your body's not repairing as swiftly as it could if they weren't so tired, right?
Well, I know even if I'm well, I'll get sick if I don't sleep. Right? You
Yeah,
get the
sure.
flu after, you just up and
You just
not
can't
getting
anymore.
sleep.
Yeah, you just can't anymore. Your body will tell you, all right, game over. You need to stop. And it shuts you down. So, yeah, this is all exciting. Could you stay for the second half?
Sure
That's
can.
great. We will be right back. You are listening to Healthy Lifestyle, Lori-Ann Casdia, and we will be back after these messages. Welcome back to Healthy Lifestyle. I'm Lori-Ann. If you have any questions, comments, or ideas on topics you'd like to hear or guests you'd like to hear more from, why don't you email us at healthylifestylewithla@gmail.com. That's healthylifestylewithla@gmail.com. And of course, follow us on social media at Healthy Lifestyle with LA. Really appreciate those messages that you send and emails that you send. Try to get back to all your questions and comments. Love some of the ideas coming in. We're implementing those in the next couple of weeks. So thank you. Keep them coming. We love interacting with our audience. In the meantime, we're here with Dr. Michael Grosso, super Chief Medical Officer and Chairman of the Department of Pediatrics at Huntington Hospital, part of the Northwell Health family. And we've been talking about all these new exciting programs going on at Huntington Hospital. But I want to talk about something else today, Doc. I'd like to talk about immunizations, because there's a lot of stuff going on out there, and I'm hearing things, and I really like you to set the record straight. And why don't we just start with the measles? I know there's some, I don't want to use the E word, but there's some
outbreaks.
Okay, we'll say outbreaks. There are some outbreaks of measles coming along, and is this associated with people not getting the measles shots, immunization?
Yeah, unfortunately, we've done a natural experiment, because public health officials have wondered how low the immunization rate can go before you have an effect, which is just like throwing a lighted match on dry tinder.
So now, did we do this on purpose, or did this just occur?
No, this is the unfortunate natural experiment that occurs because in pockets around the country, including where we live, right here, there are groups of individuals in high concentration who haven't received measles immunization.
And do we know why?
Generally, this is because I'll tell you what it's not because of. If you look across the country, the highest immunization rate in the country, in a study done a couple of years ago, was in Mississippi. Poorest state in the country. Lowest immunization rates were in California, Colorado, and New York. High socioeconomic status, lots of wealth. So it's not as in the rest of the world where it might be about access. This is a self-inflicted injury, something that we've done as a society.
So wait, let me repeat that back to you. What you just said and what I just heard is that the higher socially economic, wow, it's hard to say on a Monday, even though we're talking on a Saturday. You're saying that they are choosing not to get the immunizations.
Yeah, for a variety of reasons. And actually, let me share a fun fact. If you look at the United States against the rest of the world, it might not surprise people to know that Germany has a higher immunization rate than we do, or maybe that Spain does. But here are some other countries that have higher rates. Portugal, Greece, Turkey, Morocco, but also Mozambique, Malawi, Zimbabwe, Botswana, and Tanzania. So you
have a higher
rates
rate
of immunization than in the United States.
What accounts for that?
Well, because the World Health Organization has done a good job finally in moving immunizations across the globe. So the biggest problem with being under-immunized right now is having a parent who's concerned that it isn't safe. And I really feel for parents who are facing these decisions. They're receiving so much conflicting, confusing information. And, one of the issues is that science isn't really democratic. There are debates about lots of things. Should there be school lunches? Should healthcare be free? Should we have income tax? When it comes to these scientific issues...
No to the income tax.
There you go.
Sorry. But we just solved that problem.
But we're in a marketplace of ideas where, well, if you just go to 10 websites... 5 of them say that vaccines are a good idea. Those 5 would be like the Centers for Disease Control, the American Academy of Pediatrics, the World Health Organization, and then there are 5 more, Mom and Dad's Anti-Vaccine Club, and 4 others who are saying the opposite.
But let's be honest, you can go on, I'm sorry to interrupt, you can go on the internet and find whatever position you're looking for.
Yes.
It's similar to a law study, is I can find cases that will support either side of the issue that we're talking about, and it's just a matter of finding what you want. It's like listening to stations, radio stations, or news media. You can find a station that has like-mindedness of you and never listen to the other stations because you agree with them. So this is what's pretty much happening here, is what I'm hearing.
And what I'm saying is that there are certain things in the world that are either scientifically true or not true. It's not that everyone's entitled to their own opinion, said Daniel Patrick Moynihan.
Yes.
But not to their own facts. And for the measles, it's actually beyond any question. There are rare side effects of measles vaccine, but they have nothing to do with the side effects that parents worry about. The likeliest issue is a rash from the vaccine, or fever from the vaccine.
Sure, my kids used to get fevers.
Yeah.
But let me ask the really tough question. This is a question that I'm sure my listeners have on their mind, and you may not like it, but I'm going to ask it anyway. Yeah. Here's the tough question. So, do we think that some of the concern with the medical science has to do with 1 year we should have circumcisions and other years it's not so important, and sometimes we should be breastfeeding and other years it's not as important, and the conflicting over the years, it's like, it's the in thing to do this year, not the in thing to do that year. Do you think it's falling into that?
It could be. It really could be. The difference is that the quality of the evidence here is such that look at measles specifically. It's actually the most overstudied question in all of infectious disease, meaning the question is there a relationship between any neurologic condition and the measles vaccine? How many studies do you think have been done to look at that? 5?
No.
10?
No, thousands.
60. Well, each study, don't forget, each study costs millions and millions of dollars to do.
Okay.
62 different studies have been published in the literature, all within the past 10 to 15 years.
With the same results?
All have the same results.
And how many studies have been made that didn't have the same results?
None.
Very persuasive. That's very persuasive. So now, why is everybody so conflicted about this? Because it's like I told you in the break. My brother's a neonatologist. He said get the immunization. I'm like, oh, okay, because he should know. He's a doctor. So why is there such a conflict? And how do we help parents resolve this? Because it's scary. It's scary when you read stuff and you're making that decision as a parent, and it may affect your child for the rest of their lives. Every decision we make as parents, we sit there and we chew on our nails and go, I hope that was the right one. And we do the best we can with the information we have at the time.
Well, one of the reasons for reluctance about a number of vaccines is not just about what people hear about side effects, but the idea that the disease itself involves such a remote possibility. Why would I take any kind of a risk at all when my child is never going to be in contact with this? Or if they think their child may be in contact, so what, right? So I think one thing about measles is that people have forgotten how severe it is, because how many people have seen a case of measles? I only saw maybe 2 cases in my entire 30-year career. But we know from the data, because measles exists in places now, your likelihood of being admitted to the hospital if you're diagnosed with measles is 1 in 4. Your likelihood of dying is 1 in 500. You have another 1 in 500 risk of developing encephalitis, a brain infection that frequently leaves neurologic disability of its own, mental retardation and other problems. So the risks associated with being unimmunized are not remote at all. And the more outbreaks that occur, the more worried people rightly are that they're actually going to encounter measles and get sick.
So now there's the other side, which again, you may not like this. The other side of the spectrum is we're having outbreaks in New Jersey, as I understand it, Brooklyn, as I understand it, Rockland County, yes. Correct? So we're having these outbreaks, and I, as a parent, and them as parents, other people making this decision are negatively infecting my children. I made the decision to get the immunization for, but could my children with the immunization, is the risk higher now as a result of the fact that they're in contact with other people, or immunization will absolutely protect them and they don't have to worry about the children who aren't protected and are catching? Having outbreaks?
That's a really good question. So there's 2 pieces. If you are immunized, you are mostly protected. Put this another way. In the most recent outbreak, 97% of the cases were in individuals who were either under-immunized or unimmunized.
Okay.
Most individuals had received 0 doses of measles vaccine, and a few had received 1 dose. Only 3% of people had been immunized. But there is that 3% too. What vaccines do is to dramatically reduce your odds of getting sick. They don't completely eliminate.
Sure. So, and you mentioned...
And if you're young, what if you're under 12 months old? You can't get the vaccine. Well, you can, but it doesn't really work.
So, but if you said under-immunized, how do I know as a parent that my child's been under-immunized?
If you've received fewer than 2 doses of measles vaccine by the time you're 4 years old, you're under-immunized.
Okay. So that... elevates the potential risk.
Right.
Okay. So what I'm hearing is that the chances, if you are immunized, the chances of the children contracting it is
very low.
Very, very low. Not immunized, very, very high, especially if they're in an outbreak area. And we're finding that in these areas where they're making those choices not to have them in large groups, we're having outbreaks.
Right.
Outbreaks. So what do we do? What's the solution here? What do we think?
So there's been more attention to this issue, I would say, certainly within pediatrics and primary care and public health than almost any other over the past decade or more. And there are some strategies that we talk about how to talk about vaccines in the office. This is a very difficult thing.
Share the numbers you shared with me earlier about this outbreak, what this means significant-wise in numbers and based on past history before immunizations.
So if we stay on track in 2019, we'll have well over 1,000 measles cases by the end of the year. And that will be more than any other year since endemic measles was declared eradicated back about 1990. So this is a dramatic departure from business as usual, as it were. It's a big uptick. But again, it's a predictable uptick if the numbers of immunized people remain low.
So this is remediable. This is something we can do something about, make sure it doesn't happen, stop it in its track. That's the whole purpose of immunization, correct? Right. So that we don't have these outbreaks and we don't have things like and I'm going to be very dramatic here, the plague. That's how we stop it, by having these immunizations. Do you think some people just don't like the fact that the government is telling us you have to have that or your kid can't go to school?
Yeah, I mean, there are all these...
Because I know I don't like to be told what to do.
Sociologic things. You know, it's funny. There are parents who will ask whether a vaccine is required by school or not. And every state is different that way. Mostly, government gets involved when it's a highly communicable disease.
Right.
But not all infectious diseases are communicable.
Right.
So in theory, the government doesn't care if you get tetanus and die. All right, because you can't give it to somebody else.
Well, all right. It's fair enough, because they're responsible for health and welfare.
Right.
Right.
Thank goodness the tetanus vaccine is bundled with two other vaccines, the diphtheria vaccine and the whooping cough vaccine, which are highly communicable.
Right.
And so the DTP vaccine is required in order to, at least in most states, in order to start school.
So I hate to jump off this, because this is a really great topic, but I just want to cover one more thing, and our time is like zooming by. HPV, that vaccine. I really want to take some of the stigma out of this, because it's a really important vaccination. It's available now. We didn't have it, when I was walking to school years ago. I'm just joking. My son always says that I took horse and carriage, and how was that? And I assure you that I did go on buses. But anyway, so talk to me about HPV, the value of it, the craziness that people say that, that children are sexually active and that's why they need it. And talk to me about that.
Sure. So it's first important to know that 79 million Americans are infected with the virus called human papillomavirus, HPV.
Right.
And it's also important to know that HPV is the principal cause of cervical cancer in women and several other cancers that affect both genders. There are penile cancers in men. There are cancers of the head and neck that are caused by the same virus, and also certain cancers of the gastrointestinal tract. But 30,000 men and women each year are affected by cancers that are preventable by receiving HPV vaccine. Now, the vaccine is administered routinely at the 11 or 12-year-old visit. And the reason why it's given then, the reason why public health officials, the CDC, American Academy of Pediatrics, recommended that age is twofold. One is that that's the same age when certain other vaccines are given, and we know that when we do things all together, it's likely or likelier that we won't miss as many people, because not everybody takes their child to the doctor every year.
Right.
The other reason has to do with the way the vaccine works. The older you are when you get it, the less well it does what vaccines do, which is to stimulate your body to make protective antibodies against the virus. So, for example, if you wait as long as 15, you have to take a whole extra dose of vaccine even to get to roughly the same place as if you had taken just 2 doses of the vaccine when you were younger.
So how does the body know? How does the body know you're 15 and not 16? How does it know? Like, could I take it at my age now if I needed it?
It's actually licensed up to the age of, I think it's 26 or 29.
You just missed it.
Yeah. But no, our immune systems change with age.
Okay.
And you wouldn't think that aging would begin as early as that.
Yeah.
But your immune system in the first decade of life works a little differently than in the second or third decade of life. And so getting it really early seems to be better. In fact, the vaccine is licensed by the FDA for administration as early as 9 years of age. And personally, I'm a proponent of moving the age earlier.
Yeah.
Because of something you said a moment ago, a lot of parents have this sort of all mixed up with their doctors about when their child is going to become sexually active. It's not about that.
Right.
It doesn't matter whether it's going to be 14 or 24 or 34. It's about when the vaccine works to give you the lifetime of protection that you need.
And HPV resides in all of us. It's just whether or not it's activated, right?
Well, at least 79 million of us. It's a large fraction of all people in the population have or will become infected with the virus. By the way, that's not fate. I want to tell you about the story of Australia.
Okay, you have only a couple minutes, so make it quick.
Australia is on track to eliminate cervical cancer in the next 9 years.
Wow.
Because they've immunized almost the whole population. None of them think it's dangerous. And they'll come to the U.S. and realize, well, I suppose if they're an adult, they'd better have protected sex because it's only the crazy Americans who are still passing this virus around.
Right.
So other parts of the world are getting way ahead of us on this.
I gotcha. Yeah, because it's only the last few years that we've really come to know what it is and been hearing about it, and there's been public announcements about it. But that's where all that craziness comes from, that it's a sexually contracted disease and all these other things. So at the end of the day, in a quick synopsis, best to have our children have it, both male and female children, around 11, 12 right now, 12, right. Maybe even sooner. Talk to your pediatrician, correct?
Exactly.
Right. If they want more information about this or other things that Huntington Hospital is doing, is there a way for them to contact you?
Well, they could certainly contact me at mgrosso, MGROSSO, at northwell.edu. For more general information, I really encourage people to go to cdc.gov. It's a wonderful website, lots of information about that and many, many other health issues.
Gotcha. This has really been enlightening, and I could talk about immunization for a long time. And then the things you don't know as listeners is that Dr. Grosso sits here and spews all these numbers off the top of his head, which is totally amazing to me. It's very enlightening, and I really like to provide some information that empower our parents. And again, just because you read it, you see it on the internet, doesn't necessarily make it true. Check with your doctors, check with doctors like Dr. Grosso, check with the Huntington staff, Huntington Hospital medical staff, because they will lead you in the right direction. You can also empower yourself by going to cdc.gov. These are scientific studies that are going to support the information that you heard today, and also support you in making your decision that you have to make. It's a tough one, but we want to keep our kids safe, and we want to base it on good information, right, Doc?
Absolutely right.
Yeah. Anything else exciting coming on?
There's always more things to talk about.
All right. Well, we'll have to have you back then. Always a pleasure to have you. Thanks you so much for being on.
Thanks for having me.
Pleasure. Thank you all for joining us today on Healthy Lifestyle. My heart is always lifted by sharing this time with you. I want to thank our guest, Dr. Michael Grosso, and of course our producer, Brian, who's outstanding. Join us next Saturday right here on Long Island News Radio 103.9 at 3 p.m. In the meantime, follow us on social media at Healthy Lifestyle with a LA. Send questions or comments or other topics you'd like to hear more about. And remember, do a little something for yourself every day. It starts there. Doesn't have to be big, but definitely take a moment to do something for yourself every day. Create that habit, create the new balance. And thank you, as always, for joining us on Healthy Lifestyle. I'm Lorianne Casdia. Until next time, show up for you and show up big.